start off this afternoon's briefing by thanking the many city employees that have worked extra hours on this. I also want to thank Dr. Davis, who's a little bit late. He's had to take a phone call before he could get over here. Jeff Davis, who is from the State Division of Health, has done a great job of working with city staff both in the waterworks and also in the health department. Also, I want to thank the people of throughout the metropolitan area, particularly those within the water utility district, the 10 suburbs and the city of Milwaukee, for their patience, for their helpfulness to each other. Also, the media, I think, for the most part, has been very, very effective at getting information to the people so that they know what to do, particularly dealing with the boiling advisory. I was just complimenting you, Dr. Davis, on the fine job you're doing, and I appreciate the help that we've gotten from the Division of Health in the state of Wisconsin. There are some things that I want to review. One is the Howard Avenue plant was closed this morning at 8:30. That was done not because we've reached a scientific conclusion on either the Texas intake or the Howard Avenue plant, but because based on the circumstantial evidence and the fact that no harm would be done by closing the Howard Avenue plant, we have closed it. It was closed at 8:30 because that's when a test was completed. The test results from that test, both the water coming in and out of that plant, will be available sometime tomorrow, and our next news conference will, among other things, will focus on the results of that test and what they mean. We won't really know what to say about them till we have them, so to bear with us on that. Also, there are 42 stool specimens now available to us that have been tested for having Cryptosporidium. I want to caution the media about that. We had 8, then 23, then 42. That doesn't mean that the disease is growing geometrically. It just means that we have received stool samples from hospitals and clinics, and those are confirmation that the disease exists. There are no doubt many, many more people that if we tested everybody, all 800,000 people who live within the water district, I'm sure we would find many, many more samples that would contain that, including probably from people that didn't become ill as well. Another thing I wanted to mention was that and Jim Kaminsky, the Public Works Commissioner, will talk more about this later if you wish. They will test regularly from now on for Cryptosporidium. They'll have the equipment that they need for that, and they will do that in the future. I talked to Donna Shalala today, the Secretary of Health and Human Services at the federal level, and she says that they, at our request, are considering adding Cryptosporidium to the routine tests that physicians do when people have gastrointestinal problems. There are some tests required by the federal rules, reporting required by federal rules, and we've asked that Cryptosporidium be added to that. We also are not, I wanted to announce that we are not seeking any more filter. We are not seeking to identify more filters. We appreciate the media getting that number out. We now have enough people who have called the health department who are willing to provide or allow us in to test their filter, which is, we want them to keep it on the faucet, not take it off. Those people will be contacted very shortly. Some already have, and we will test those filters on site. We don't need to have any more people who have filters call in. We have enough of those. In terms of the two main subjects that we have here, the health part of it, the determination of what happened and where it is, and what the quality of the water is. Paul Nannis and Dr. Jeff Davis will talk about that, and also Jim Kaminsky will talk about the waterworks operation. In searching for the sources, it's important to remember some of this. Remember that there are many possibilities, and some of them could be in combination, and we can't be sure what they are. We're dealing in an area of where we're still groping for more information. When we do reach a conclusion, even if we have inadequate data, we can reach a conclusion if we know that it won't hurt the public. For example, when I declared the advisory 2 days ago, I did it without knowing for sure whether the advisory was a good idea. I think it was a good idea, but we didn't have a high level of information as we'll want when we take the advisory off. The same thing is true with closing the Howard Avenue plant. We don't know for sure what happened to the water as it comes out of the Milwaukee River and then goes into the lake, what's in the water, where it's from in the river shed. There are many possibilities. Goes into the lake and then passes into the intake and then goes into the plant. Whether there was a malfunction in the plant, whether whatever it was that got through despite the plant working as it should. Those are things that we don't know. It could be that both things are true, that the problem was something that was in the river that came through the intake, as well as that the plant didn't function right, and many other combinations of possibilities. The reason I mention that is to caution everyone to jump to any particular conclusion. There's plenty of time for that as time goes on. The key factor now isn't so much to find out exactly what happened. The key task that the committee has that meets every day is to determine at what point is the water safe, and can we remove the advisory, or can we alter the advisory in some way. And that is something that as these test results come in, we will focus on. The long-range issues, the question of what happened and why and what remedial methods would make it less likely for something to happen again, is a longer-range question, and not something that we're as focused on as we are on just the question of how do we determine when the water is clean enough so we can take the advisory off. Again, I want to compliment the state and local officials as well as federal people who haven't met, but the staff people have been spending a lot of time, Dr. Davis, Paul Nannis, and others on the phone, talking to federal officials who they've become very familiar with and who have responded and are performing tests for us and giving us advice very quickly. At this time, I'd like to ask Paul Nannis to come up, and then Dr. Davis, and then Jim Kaminsky.
Thank you, Mayor. I'll be very brief. I don't have much more to say. The Mayor's captured for you the same concerns that I had. Mostly the concern I had is that I've talked with many of you, it feels like I've talked with all of you, and people keep wanting to know from a health department perspective, who can we blame or what is the source? And I just want to reiterate what the Mayor said, which is clearly my feeling, is that until we know, and we know with complete evidence what is happening, we'll continue to look at all options. And that means some of you focus on water and some of you have focused on point and non-point pollution and agriculture and livestock and any number of other things, and tend to run with that particular story. As far as the health department is concerned, nothing is ruled out until we have gone through the rigorous investigation that's underway, and until that point in time when we can say it is something, we'll continue to say it's everything. And I know that that's frustrating for you, perhaps for the general public, but there's no other way to do that in good science and in good public health and in the interest of the public generally.
Dr. Davis will be next, and as long as he's coming up, just to give you an example of how everyone can focus on something and then have it not be the factor There was a lot of discussion and rumors and even some press reports about a meat processing plant that handled culled dairy cattle or adult cattle. And the disease we're talking about has to do with calves, according to Dr. Davis, not adult cattle. So even based on what Dr. Davis said, I wouldn't be ready to rule out that kind of option. But that's the kind of thing that may be very, very interesting for the media to focus on, but it's something that over time a lot of information will come out, and what we'll find, I think, without a doubt, is that everyone, whether they're in the business community or government, or whether they're in a rural area or urban area, everybody needs to do more to clean up the environment. That's something that undoubtedly will be a conclusion. But anyway, Dr. Davis has some information he wants to present, and then Jim Kaminsky.
Thank you, Mayor. Thank you, everyone, for being here. I just wanted to report that we are working on a variety of fronts to try to understand the occurrence of illness. And most of what I'm going to tell you is that we're making a lot of progress. It involves getting collecting data in a format that would be consistent for analysis, getting hospitals and nursing homes and some absentee data from other non-healthcare providing settings to do, and laboratories, many, to complete a lot of information. Requires a lot of their staff to go back and collect the information just the way we want it. We've been getting excellent response, and we are very, very busy with our staff entering data and working on reading and analysis. And we are also in the process of trying to get to a phase where we can complete case control studies. We're working very intensely on all of these, many different fronts, and a lot of information comes in very rapidly, and we're getting information entered. We'll get it analyzed rapidly. We're working very intensely on this. So I don't have any specific results to present to you, but just as soon as they're ready, of course, they will be shared. I wanted to put the 42 cases of Cryptosporidium infection into perspective. Actually, the mayor did a great job. He said that these represent confirmed cases of Cryptosporidium, and clearly, in order to make the confirmation, those stools had to be analyzed. And there are many people out there, I'm sure, that have diarrheal illness that have not been examined for this particular protozoan. And the medical community certainly has been aware of this, and I suspect that we'll get many more cases reported to us in large part because of awareness. One thing that you need to know about the organism is that the typical incubation period is anywhere from around 5 to 7 days, with a range of anywhere from 1 to 2 days to 12 to 14 days. So somebody could have been infected 3 days ago and gotten and has onset of illness today. Somebody also could have been infected 12 or 14 days ago and has onset of illness today. So another thing that we have to try to correlate our stool culture result dates with is when people really had onset of illness. And then that gives us a better idea of what we could try to work out when exposure may have occurred, along with other indicators that we have from other sources. So we're in the process of trying to correlate that. In order to get accurate information, it does mean interviewing quite a few people, and we'll try to get that information to you just as soon as we possibly can. I just want to thank all of the different healthcare providers and extended care facilities and other units that have provided us with absentee data, the laboratories, for providing the information that we've requested in a very rapid fashion, and that's been very, very valuable. The objectives of the investigation, of course, are to try to determine what the risk factors for illness are, sources, and efficacy of control measures. And we'll just report those out just as soon as we have that information.
Jim Kaminsky, Commissioner of Public Works. Again, the mayor did an excellent job of outlining what we've been doing today. Just a little bit more, though, in regard to the water that is currently being supplied to the city. All of that water is coming out of the Linwood plant. And our Linwood plant has the capacity to supply the city indefinitely. When we shut down the Howard Avenue plant this morning at 8:30, we had no drop in pressure anywhere in our system. The other thing I'd like to talk about is the testing that we're doing. We have taken tests on the effluent water at both plants and on the incoming water at both plants. And those tests are currently being processed and analyzed, and those are the tests we'll have tomorrow. After completing those tests, we are out in the field now taking samples at some remote sites that we have discussed with the state, and those tests will continue indefinitely. We will also be looking next week at taking some other samples, and we'll be working with Dr. Davis on finding some locations along the Milwaukee River and begin conducting some tests on the river for this organism. The other question that has come up has been on the use of a chemical at our plant, polyaluminum chloride. That was a chemical that we used to as a flocculating agent in our plant. We've used that in both plants, and we began using that earlier this year as a test to look at reducing the corrosive action of water in our mains, the corrosive action that was causing a leaching of lead into the water. At the Howard Avenue plant, we discontinued the use of that and went back to alum on about April 2nd. We're looking at that change. We're looking and analyzing at what we did during that time. But at this time, we do not think that caused any particular problem.
Mr. Kaminsky, the mayor mentioned you're not ruling anything out at this
Exactly.
point. And that there perhaps could have been a malfunction. Is there anything you're looking at specifically?
We are continuing to look back at what we did in that plant for the last month, and we cannot at this point find a malfunction, but we're continuing to look at that and analyze that. And next week, we'll even be bringing in more expertise. We'll be consulting with other engineers who might know something we don't know, but we're going to continue to look.
So the people on the south side that complained late March, early April, that their water was murky, there was dirty water, and they called City Hall. City Hall said call the Howard plant, and you said everything's fine. Is there any correlation to the murky water that was found in some of the south side homes and this problem?
There was a color problem, and Jim Wagner, our plant manager, can be more specific if you need that. There was a color problem when we were using the polyaluminum chloride, and the color problem was a result of an interaction with potassium permanganate, which is used as a disinfectant to control and also to control taste and odor. Because we were getting that slight variation in color, the decision was made to discontinue the use of polyaluminum chloride and go to alum.
So it didn't have to do with anything with runoff?
Nothing at all with that, no.
Sir, have there been any security problems at that Southside plant, say, in the last 6 months? And is one of the things that's being considered the possibility that if the water system was contaminated, that it was done intentionally?
We're not aware of any security problems at that plant.
Is the potential for intentionally doing this something that's being looked at?
It's a possibility.
It's a possibility.
It's unlikely, but we can't rule anything out. But let me try to put it in a different perspective. In the long run, we have a long time to determine what happened and why, in terms of trying to figure out if somebody made a mistake, or if what material came into the river that went over the intake, and what happened in the plant and all that sort of thing. What we don't have, I believe, where we don't want to take a lot of time on, but we want to do thoroughly, is to focus our efforts on examining the water, testing the water. If the Linwood plant, if the Linwood plant is producing good drinkable water and it fills the system, and we test throughout the system and find that there is not the organism present, then we'll have a meeting and we'll determine that it's time to take the advisory off. The time frame for determining what went wrong who did what, which happened, where, and all that sort of thing. Although I think it's important for that to be an ongoing process, for this particular team and for me, the important thing is to make sure the water is safe right now. If there was, for example, sabotage, which is unlikely, we think that's very unlikely, but they are checking throughout the system. They're looking at some of the facilities like water towers, for example, and so forth. And if there's a way to detect it, I think the water department people are likely to detect it. But the key question for us is, how do we make the water safe so that we can make the announcement? We can all have our glasses of water fresh out of the tap and drink it, and tell people that the water is safe enough to drink, take the advisory off. The key question the other night, 2 nights ago, was, would you drink the water? And the answer was no, and that's why the water advisory went on. And when we can safely drink the water, then the advisory will go off. The long-term questions of what happened when, I wouldn't rule anything out. The water department is continuing to look and look and look for things like that, but the main focus of their efforts right now is to make sure the water is safe.
You seem to be focusing most of your attention on the Howard Avenue plant. You say you're doing testing at both plants.
Yes, both plants.
Is there a concern? Are you fairly confident, though, that there is not a problem at Linwood? Therefore, tomorrow you'll be able to lift the advisory. Are you pretty confident that the levels there are acceptable?
We would still not lift the advisory. Just finding out that Linwood was producing good water would not immediately trigger lifting the advisory. We would want to do some tests around the system to make sure that the organism was gone, and I don't know how much longer that would take, but those tests are really important tomorrow. I wish we could get all the tests. These are the kind of questions I ask when we have these meetings. I'm saying, Dr. Davis, why can't we have all the tests tomorrow? And we can't. Technically, that takes longer than that. But if we find out that the water plant, the Northside water plant, is producing safe water tomorrow, that'll be a big step forward.
Are you going to wait then to find what the source is, how this got into the water before you lift the advisory?
Well, that wouldn't be the key question. The key question would be, is the water safe? I mean, if you get into the question of source, you've got the whole route of conveyance all the way to the person. Everything that's in that plume of water that comes out of the Milwaukee River, it comes from the entire rivershed, including in Milwaukee. Point source, non-point source, there's all kinds of possibilities. So it could take a long, long time to get all of the information and come to all kinds of, all the conclusions that you have to about what happened. We don't need that information to determine what should be done about the advisory. What we need to know about the advisory is the water safe?
And that's why I'm unclear about tomorrow. Won't you have that information at least about Linwood?
We'll be a lot closer to it. And I think we want to look at that information. We don't know what the results are yet. When we look at that information, we'll determine what additional information, if any, we need, and then we'll make an announcement. And at some point along the line, Dr. Davis and I will have a glass of water together.
Mayor, what if it's not the water? What are you working on besides the water?
Well, that's something that it's very likely.
We need to, through our evaluations, doing case control studies, assess a whole host of risk factors, which we're in the process of doing.
Like?
Well, we want to look at access to pets and risk factors there, food-related questions as well. We're talking about gastrointestinal illness, so we'll look at factors associated with that. We look at the potential for secondary spread, and assess, whether or not somebody might have gotten it secondarily as opposed to getting it from water, things like that.
When you had your first 8 cases which tested positive, you said the only link that these people had was the water, as far as you could tell. Now you've got...
No, we didn't say that. We said we had 8 cases of Cryptosporidium infection at that time. We were in the process of collecting information. I can't tell you, if there were other links.
Are you seeing any links now that you've got 40-some cases?
No, because we have to complete the we have to complete all of our interviews. We haven't interviewed all of them yet, and we need to maximize the information that we do have.
It's amazing. You ask the
interviewing.
same questions I ask when we have our meetings.
Well, I mean, I'm going to keep asking it. What if it's not the water? I mean, you wake up Monday morning and you find out your water all tests clean.
Well, the prudent control measures were taken given the information that we have. You have an organism that is classically a waterborne organism. When you have situations involving secondary spread, you wouldn't get an outbreak of this particular magnitude. Foodborne transmission of Cryptosporidium hasn't been described to this degree of magnitude. I think you just have to look at the history of disease associated with this organism, look at it based on whatever information that you have when you feel, and ask yourself whether a control measure can be taken, and if so, when. And the decision was made very rapidly to take that control measure once preliminary information was available. We're still in the process of trying to complete a very objective and extensive investigation, which takes quite a bit of time and a lot of people.
Can you characterize the magnitude? It's been a while. You said you were having a hard time gathering numbers. How many people have been affected? How many people have been seen in hospitals? Do you have any?
Well, the one thing I can tell you, we know that, as Tom Schlenker said the other day, hundreds and hundreds of people have been sick. We aren't getting reports of every occurred, but what we are trying to do is assess the magnitude of certain indicators. For example, we're trying to look at absentee rates, and we're trying to do it in different parts of town. We're trying to do it objectively. We're not asking for everybody to call us with their absentee data. We're trying to select a mechanism for having reliable data. That's one way of probing it. We're trying to look at people that are somewhat captive, that are somewhat immobile. In other words, they aren't likely to be traveling around the town, and look at the occurrence of illness in people at different parts of the city that are not likely to be moving around. We're trying to look at laboratory data. For example, if in catchment areas, if people tend to go to their healthcare providers for a variety of reasons, and they tend to go to healthcare providers in certain areas for reasons. For example, do they go to healthcare providers because it's close to their home? Do they go to healthcare providers because it's close to where they work? We want to try to understand that in relation to the water system and other things, and try to look at the occurrence of illness in that regard. So we're doing all of these different things. It's taking quite a bit of time to get the information in relation to the fact that we've started the press conferences just a few days ago. However, things really are moving very rapidly, and we're trying to get all this information in, and people have been very cooperative. The city government has been extraordinarily cooperative in activating a lot of systems, because this couldn't be possible without a real responsive municipal government.
Could I just add that in response to your alternatives to the water hypothesis, the other possible threat modes of transmission are person-to-person, which is usually viral, and foodborne, which is usually bacterial. Our lab has tested approximately 60 samples that we have received, and there are no viruses and no bacteria showing up with any regularity at all, as opposed to the crypto, which is very prevalent.
Now, the other viruses that can't be tested for here, the CDC is going to be helping us with those, but it's going to take a while to get those results back.
How many people have been tested, or how many tests have you done to come up with 42 positive results?
I don't.
I would like to know that. We don't know the precise number of stool specimens that have been obtained. We know of one situation where we asked a laboratory to go back and find if they saved stools from specimens that were obtained for the purposes of bacterial culture, if they could go back and test those for ova and parasites, and looking for Cryptosporidium and anything else.
We'll try to put that together.
And we'll try to put that together. We do know that a high proportion of that small sample of stools that were available was indeed positive for Cryptosporidium, negative for Giardia, and those stools were tested for ova and parasites in large part because we knew that they were negative for bacteria. So, that was a very high yield thing, and that tells us quite a bit. I realize that was just one laboratory, and we certainly want to look at the distribution of those cases. But we use those kinds of indicators to help us understand what's happening in this particular outbreak. We have a variety of other feelers out as well. For example, we're trying to collect information on people who were in Milwaukee for a window period of time and then left, and looking at illness there. And we're trying to get a mechanism going to receive. We've received some reports, and we're trying to look at those and have a mechanism for getting other reports to us. So we're activating a variety of systems to get as much information as we absolutely can.
So we really don't know what percentage of people are getting sick or who are drinking the water? I mean, could it be a combination of things that are causing sickness?
Well, with water, I mean, people need to drink things, and it's really essential to stay hydrated. I mean, all of us are on this earth as a result of staying hydrated. But what we want to do, we have to look at a variety of factors to try to measure the intake of water and sources and the types of things that people. That's just one thing that we're looking at, and we're gonna quantitate that as best as we possibly can, and it will, and then we'll have those data to report back to you.
I do want to. What's that?
You know anybody who's become acutely ill in this?
Well, I'm glad you asked that. I was just going to make the point that it's important for everybody to realize that the boil water advisory is still on. And it's important for people not to drink the water until that advisory is taken off. And even when it is taken off, for people who, and we've tested around and we aren't finding the organism, when that happens, even people, I would suggest for people who have pre-existing health problems, who might have HIV, to continue for a while to boil water. The boil water advisory is still on, and if somebody had a pre-existing health problem, if there was some kind of HIV infection or some other health problem that they had that was severe, exposure to this organism could result in death. Unfortunately, so far we haven't had those tragedies, but there are some people that are in hospitals. I visited a hospital today, and the person I visited was getting better, but there are 12 or 13 people or so at St. Francis Hospital who've been infected and are hospitalized and still are showing symptoms. So it is a disease that could potentially kill someone who had a pre-existing health problem or had something else happening to them, that this would make it even worse. It's important to remember that. We're talking about people's health and lives here, and that's why it's so important that we get the information we need, and particularly focus on making sure the water is safe, and that when we determine the water is safe, to lift the advisory only when the water is safe. And that's what our main focus is on right now.
Mayor, could you respond to Bill Drew's decision to collect data in anticipation of a lawsuit or claim against the city?
Well, one of my staff people received a call this morning from Tom Ament saying that was meant to be gallows humor or lighthearted, and we've had good cooperation with the county, and I think that Tom Ament and his people want to pull together and help to get the community through this crisis. So,
did you think it was funny?
Well, no, I didn't, but regardless of that, I want to say that the county, the state, the federal government, and our local people, and all of the businesses and community-based organizations, water businesses and others that have helped out, I really appreciate it, and there's been a real effort. The media has done a good job of getting the information people need out there, and everyone appreciates that. Dr. Hansen works on epidemiology for a living. This is something he knows a lot about, and he's been really impressed with the media's response to this, to help to inform people so that they have the information they need and don't get information that is inaccurate. And for the most part, I think almost everything the media has put out there has been very helpful.
This decision that you're now going to regularly test for crypto, why the change and how much is it going to cost?
Jim,
It's not a very difficult test for us to do. We need to get our staff trained on it. It's a matter of buying some relatively inexpensive equipment. It's not going to be thousands and thousands of dollars, so we think it's a worthwhile thing to do. But it's going to be first a matter of getting some equipment, which will include a centrifuge and a microscope, as I understand it, and getting a trained staff, working with officials from the Department of Health and with EPA to make sure we're doing it right.
Why did you change the AIDS group was making some claims and so on?
It's something we've just learned about, and we find out it's a test we can do, and we think it's a test we should do.
Commissioner, to go back to something you said earlier, at this point you're not looking for sources along the Milwaukee River, but you and Dr. Davis are going to try to identify some sources next week as potential sources?
Identify some sources where we can, some spots where we can do some testing, yes.
Where contamination might have gone.
Yeah, the reason why, right now it's very important to sample the water system as rapidly as possible. There's only limited amount of equipment, and it's being used, continuously because these samples take 8 hours to collect. So all of the available equipment is being used on a continuous basis, and we just have to stage the order of priority of the samples. And the river will be tested, rapidly, but when the equipment is available to test it.
2 comments, if I may. Just want to reiterate something that the mayor said. If you could all remember to print it if you could, or announce it if you possibly can. We're no longer asking the public to call us about the filters. We had a great response. People really want to help out. We really appreciate it. We had about 200 people who volunteered their filters. That's going to allow us to sort through that, pick those that we need, make sure that it's geographically distributed appropriately so we're not soliciting any more filters. And before everyone... Yeah, keep them in place, don't take them out. If we need them and we want them, we will get back to you. We took numbers, we'll figure out a way to get them. Just hang tight and we'll get back to you. The second thing, before everybody breaks up, because we are hopeful to have the test results that were sent off last night tomorrow, we're not going to set a time for meeting tomorrow. Once we have them, instead of setting a time and knowing or not knowing if we're going to have results, please call my office. We're going to be working again tomorrow. The same numbers will be good tomorrow as well. And we'll let you know when we'll convene and give you the results as soon as we have them.
Thank you very much.